Hello everyone, I'm Dr. Aditya Sai from the Shoulder and Knee Clinic. Welcome to our channel. So today we'll talk about shoulder replacement surgery. What are the details, how is your recovery post the surgery, how you can achieve a faster recovery, when is it indicated, what are the symptoms that indicate that you need to meet a shoulder specialist. So a lot of shoulder problems present with pain in the shoulder. When does this pain become significant? When you have taken treatment, you have done physical therapy and your symptoms are not improving. If you are not able to lift your shoulder, if you have pain in your shoulder in the night, all these things indicate that there may be a significant problem in your shoulder. In these scenarios, you need to meet a shoulder specialist. You may be advised X-rays or MRIs of your shoulder to diagnose the problem. Based on your symptomatology, the imaging findings, a further treatment can be suggested. So, majority of the shoulder problems can be repaired with a reparative surgery, wherein the torn muscles are repaired. For that matter, if there is any pathology like cartilage where if it can be corrected, a lot of these problems can be treated through arthroscopic or keyhole surgeries. However, there are certain scenarios where that is not possible, and in those scenarios, shoulder replacement comes into play. So what are these scenarios? So firstly, if you look at the shoulder, it's a ball and socket joint. It's lined by cartilage which is smooth. Now, in some individuals, with age there is wear and tear of the cartilage and it becomes rough like this. So these rub on each other. Typically, individuals will get pain in the shoulder throughout the movement in the day as well as night, and they'll have restriction and difficulty in shoulder movement. So this is known as primary osteoarthritis of the shoulder. This is one of the indications for a shoulder replacement. So in a primary osteoarthritis of the shoulder replacement that is done is a anatomical shoulder replacement. So wherein there is a ball that goes here and there is a socket that comes here. So the advantage of an anatomical shoulder replacement is you get the full movement of the shoulder, the pain levels go away and you are very active. So unlike a knee or a hip replacement where there is certain restriction of activity, with the shoulder replacement, all activities are possible. Only thing we advise is don't start doing bench press in the gym once you recover. That's very important. Typically post an anatomical shoulder replacement, it takes around 4 months to get the full movement of your shoulder and around 6 months to get the full strength. After that, generally there is no restriction in the activity. Your arm is in a sling and typically the next day of the surgery you can be discharged. The sling needs to be worn for at least 4 to 6 weeks depending on the repair and the procedures done. And after that, with progressive physiotherapy, you improve your movement. The second aspect is pain control. So when it comes to pain control, daytime pain by around 2 weeks it's quite less, and by 6 weeks generally you tend to have no pain in the day. Night pain also generally goes by 6 weeks. So it's a very good surgery, gives very good results with regards to restoration of movement and pain relief. Now there are other scenarios where this is something which cannot be done. So one of them is fracture, then the other problem is muscle deficiency. So majority of fractures, especially till the age of 65-70, can be managed in non-operatively or through surgical fixation where we put plates and screws and fix the fracture. However, in elderly above 70 where the bone is very osteoporotic, or in fractures where the ball itself is broken, it cannot be reconstructed. The results are not good. So in those scenarios, a shoulder replacement is done. Now this is a different form of shoulder replacement rather than what we discussed, which is an anatomical shoulder replacement. It's called a reverse shoulder arthroplasty because in this scenario, the ball goes in place of the socket and the socket comes in the place of ball. So it's a reverse geometry arrangement. This has been designed with a view that whether there is healing of the fracture, whether the muscles heal or not, you will still get a good movement in the shoulder and removal of pain. And that is what the demand of a typical 75 to 80-year-old person is, that at the end of the day, one, they don't want multiple surgeries and they want a decent movement in the shoulder so that they are able to take care of their day-to-day activities. There is another scenario called a massive rotator cuff tear. So a massive rotator cuff tear essentially means that all the tendons around your shoulder or the rotator cuff is torn and we cannot repair it. Now there are two scenarios. One is a younger individual, say between the age of 50 to 65, who has this problem, and somebody above the age of 65 who has this problem. So in individuals below the age of 65, we try to do alternate procedures like muscle transfers or superior capsular reconstruction, which can lead to an improvement in function of the shoulder. Whereas above the age of 65, we tend to do again the reverse shoulder arthroplasty for these problems, because somebody above the age of 65 is less likely to lift heavy weights. They are mainly looking for pain control and to get a decent movement out of the shoulder. So treatment of shoulder problems is extremely individualized based on the pattern of weakness in the shoulder, based on the pathology that we observe in the shoulder and the functional demands of the individual. Now, whereas compared to a hip or a knee replacement, shoulder replacement is different. You tend to get lesser pain post shoulder replacement, the recovery is faster and the longevity is better. Typically, when we look at an anatomical shoulder replacement, at around 20 years, multiple studies have shown 80% survivorship. So that means that 80% of individuals, even at 20 years, do quite well post these kind of surgeries. These are surgeries which are extremely rewarding both for the patient as well as the surgeon, because the results are very good. So if you have any shoulder problems, if you are having pain in the shoulder and it's not getting improved, consult a shoulder specialist near your place and get it diagnosed and treated. Thank you for watching. If you liked what you saw, then share and subscribe to our channel.